Well, hello, hello. It's that time again. It's the third Thursday of the month, which means that it's Real Mushrooms for Pets, Facebook Live. And here we are. My name is Joni Kamlet, and I'm the Director of Veterinary Education and Outreach. And I'm here with my colleague, Dr. Rob Silver. We come on here every month to kind of just chat with you live about answering your questions, mainly about mushrooms and your dogs, cats, horses, etc. So tonight, and we usually start with a topic. So tonight we're going to start with the topic of inflammation and how mushrooms can help your pet with inflammation. So that's a pretty broad topic. Doc Rob, you want to start us off there?
Yeah. Well, so inflammation, first of all, we know to be the root of so many different types of diseases, especially inflammation that's ongoing and chronic. You also can get like a short-term inflammation, which may cause local short-term problems. Inflammation is a function of the immune system, and with a properly functioning immune system in situations where the inflammation isn't long-term, inflammation actually can be good for the body. Inflammation helps with wound healing and things like that, but only a little bit of inflammation, not lots of it, not long-term. So mushrooms are uniquely able to help the body deal with inflammation because they contain a variety of different active ingredients. We've kind of mentioned them a bit with each of these meetings, and the beta glucans and the terpenes and the flavonoids and the nucleosides and things like that. Every one of them has been shown to help reduce inflammation. And they do it through different pathways, which is good because when there's multiple pathways in the body, it actually is a much more robust response. Now, mushrooms don't reduce inflammation to the same extent or degree that a drug will. It won't. But the value of mushrooms for inflammation is to use them regularly, like daily, in order to train the immune system to be less inflammatory. We've talked about immune system training in previous ones, and that's what we see happening when you have substances like the beta glucans that are the dominant active ingredient in mushrooms working on the immune system. It teaches the immune system to work better and more efficiently when it encounters challenges. So that's basically it in a nutshell. I understand we have quite a few questions to get to tonight, which I'm eager because I love the thrill of answering questions.
The thrill of the questions. Yeah, I know. I hear you. And so the first question, I have a dog with a meningioma that is suffering from early delayed side effects of radiation causing inflammation, swelling in her brain. What mushrooms could help?
Inflammation again is either the result of the treatment of the cancer or created by the cancer, or low-grade inflammation can actually help to trigger cancer if conditions are right. But I'm sorry for this condition. It's anytime we have cancer in the brain and the skull, it's not a good thing. So the first mushroom I would think of to suggest for this would be the lion's mane mushroom, because the lion's mane mushroom has an affinity for nervous tissue, has an anti-inflammatory action, but also has other actions that can be helpful in terms of repairing damage and helping to normalize nervous tissue. Now, again, as I mentioned, lion's mane is not as strong as many drugs, and doing radiation on a tumor can create a very extreme event. So I think it would be a good partner. I wouldn't depend on it alone to do that, but I think it would be a good partner. And we know that lion's mane does not interact with most of those drugs that are being used to reduce inflammation, as far as we know. And we also, lion's mane, because of its affinity for the brain, can also have an effect on any remaining cancer tissue that might still be there following that radiation. So.
Right. So I was about to say that lion's mane has anti-neoplastic, so anti-cancer actions as well.
It does.
Yeah. Wonderful. So I hope that helps, and good luck. Good luck with your pup. We have a question that just came in. Would any mushrooms help dissolve bladder stones?
Not really,
No.
not that I know of. There are herbs that do that very well. Chinese herbs. I use Chinese herbs extensively in my practice
Mhm.
to do that. I created some formulas of my own. Even something like hydrangea root and stone root, gravel root are all Western herbs that are also known to do that. But mushrooms, I have not seen anything in the literature that would support that they could do that.
Yeah. And I correct me if I'm wrong, but when you are treating uh, bladder stones with herbal therapies or the that type of thing, it's important to know what type of stones, because different types of stones get treated with different herbs, whether they're struvite or other stones. Correct?
There are two types of stones,
Yeah.
basically. There's some others. The main ones we see are oxalates and struvites. And what's interesting is the oxalates live in form in an acidic environment,
Mhm.
and the struvites form in a base at a alkaline environment. And so you need to have different kinds of diets,
Right.
different kinds of supplements to help them to dissolve. Typically, I would use an amino acid called D-L-methionine, which would acidify the urine to help the struvites dissolve along with these herbs that I used
Mhm.
um, that would dissolve the stones. And then with the oxalates, we typically use a citrate, like a magnesium or
Mhm.
potassium citrate,
Yeah.
to alkalinize the urine. But we don't want to make it way alkaline, because oftentimes animals who are stone formers will form the stone that's appropriate to the pH in their bladder, no matter what. So even though we want to alkalinize or acidify, ultimately we want that to be at about a pH of 6.8 to 7.2.
Interesting. Thank you for that, Doc Rob. Our next question. My 10-year-old Aussie Doodle just had a splenectomy and removal of a tumor. The pathology report is pending. What kind of anti-inflammatory mushroom would you recommend?
Well, hopefully it's not a diagnosis of hemangiosarcoma, but it could be.
Yeah.
And I think that in this case, the most appropriate mushroom would be turkey tail,
Mhm.
and given at a pretty high dosage, because it would not just have the anti-inflammatory activity that we're discussing. That's our topic tonight, but it also has been shown to have very strong anti-neoplastic activity as well. And I guess I forgot to do the disclaimer at the very beginning that I'm not really supposed to be giving you medical advice about your animal. I'm giving you information about mushrooms and the problem that affects your animal. So I'm sorry that if it seems like I'm being a little vague about things, but I'm just trying to be ethical about it.
Yeah. Yeah. But yeah, no, turkey tail for sure. Uh, Sounds like it would be a good option for this dog.
Fingers crossed.
We fingers crossed. We're praying for a benign diagnosis of that mass that was removed. The next question: any mushrooms to help with the oral microbiome, reduce the inflammation of the gums?
It's a good question.
That's a
We
great question.
know mushrooms are excellent for the gut microbiome, and the gut is very much associated with the oral mucosa. They're all part of the same tissue, contiguous tissue. Um, Most of the things I've seen regarding reducing inflammation in the gums often involves the application of something topical as well as taking something systemic. So I don't know of any studies or any evidence about, or any production or any product that is topical with mushrooms in it. But I
Mhm.
would think that any mushroom really would be good to help the oral microbiome, because of its normal anti-inflammatory activity.
Right.
So, typically we think about mushrooms like shiitake and maitake for digestive things. Chaga can be good in that situation, um, but really any mushroom, and perhaps a choice of a combination might even be best, such as our flagship product called Five Defenders, that has five mushrooms in it: reishi, turkey tail, shiitake, maitake, and chaga as well. I'm personally fond of reishi. I wouldn't try applying it topically to the gums because it's just so bitter, but I think it has a lot of very strong anti-inflammatory benefits as well as having microbiome benefits as well.
If you saw me kind of fumbling around here, it was because I was looking. I seem to remember from some reading about shiitake being good for uh, uh, teeth and gums. And so,
Mhm.
yeah, I'm looking at a monograph that says one of the applications is that shiitake is orodontoprotective.
Oh, wow.
So,
Well,
yeah,
I learned something. Mhm.
well, the only reason, like, believe me, I'm shocked that I actually know something here. But
Yeah.
I remember when one of our colleagues was talking about shiitake and for teeth and gums, and I remember thinking, "Wow, how cool would it be? Like, I wonder how that works with dogs and cats. With because my goodness, especially small dogs. My little dog, who it's just so hard keeping her teeth and gums in good shape. So yeah, shiitake.
I was just wondering, if you're actually eating, like, let's say, the freshly cooked shiitake mushroom, because mushrooms also have such a strong fibrous content. I
Mhm.
wonder if chewing on the mushroom actually would have, a benefit in terms of helping to clean the teeth, or maybe, get there into the gingival space where they really are most needed for inflammation.
Oh, that's an interesting idea, isn't it? Yeah.
Interesting thought, yeah.
We'll just have to do some
Mm.
research on that. Some field study with our own dogs on it and see how
Yeah,
that.
I do a field study with it every night for dinner.
Yeah, exactly. So I hope that helps answer your question about the oral microbiome. The next question, best mushroom for immune support on top of five defenders. I use several, but the powder in food is getting overwhelming. Right now, white blood cell and neutrophils, like low white blood cell and neutrophils, likely due to fighting Lyme positive for a couple years. Just found this in recent labs because there were no outward symptoms. Now doing the doxycycline. Also, this all natural tick spray is not cutting it. And I hear you there.
So I'm not quite sure what you mean by for immune support on top of the five defenders. I mean, the five defenders in and of itself is excellent for immune
Yeah.
support. But I can understand perhaps the volume that you're giving might make the taste more difficult. It does have reishi in it, and which is a pretty bitter. Has the turkey tail, which isn't always the most pleasant tasting mushroom, but I'm not quite sure how to solve that problem.
Yeah.
We can't, if we add more mushrooms, then we're adding more powder. You might want to maybe consider the capsules or the chews as another way to go. But usually the powder topping on the food, unless it's not palatable to the animal, would be the easiest way to administer it.
Yeah, I would agree. Finding different ways to hide it in the food, maybe mixing it in with a bone broth or something like that. Uh,
Yeah, if I was using a single mushroom to treat Lyme's disease, I'd probably look at reishi, or I'd
mhm.
probably look at turkey tail. I think either one of them have that kind of strength. And I keep reading studies on reishi about its ability to address parasites and pathogenic microbes. So
Yeah,
in that case, that would be good. Now, the thing with Lyme's positive is oftentimes at that point they don't actually have much of the growing active organisms that the body is now reacting to what they had done. And so that's why as well as the anti-parasitic effect of the mushrooms, would also be the anti-inflammatory effect, which would be pretty important.
yeah. I was actually just doing some research on Lyme disease yesterday. I was on a podcast, and the person who was interviewing me was asking about what mushrooms for Lyme disease. So when I was looking, at reishi, was the one that I think popped up the most on the different Lyme blogs of what people are using. So I would imagine that might translate over
Absolutely.
dogs as well. Yeah, yeah. So maybe reishi on top of the 5 defenders if Facebook user, as you're called on here, wanted to add an additional mushroom, but that's bitter. It's going to be, if you do the powder, it's
Well,
if your dog is already,
the capsules can get a good dosage in there.
yeah,
And yeah.
yeah. Next question. Didn't find where to ask questions. Well, you found it. We found a tumor in the liver. Can you please give dosages for lion's mane with or without food? Best time to give. Can we give in powder form and feed real mushrooms? So a lot of questions there.
Yeah. Well, again, I think reishi has the most amount of evidence of its effectiveness in the liver. It also has some hepatoprotective properties, but lion's mane is not too shabby either.
Right.
And I can't really give you a dosage if I don't know what the weight of the dog is, but basically the guidelines that we have on the pet labeled products, 20 to 40 or one capsule or one chew for every 20 to 40 pounds. I would go, the lower weights would be one capsule for every 20 pounds, but I would go 2 to 3 capsules. I would start low to make sure your animal can tolerate it, and gradually build it up. Animals with liver problems sometimes can be sensitive to things, and so you want to introduce things gradually to them. I think that would probably be the best way. We want to start low, but we ultimately want to work our way up to a fairly high dosage. If I had the weight of the animal, and maybe you're on and you can enter that, I'd be happy to compute that, get my calculator out. We were assuming that the mushrooms have almost all about the same potency in terms of their beta glucan content, and the dosing of them, I'm using the beta glucan content as kind of my marker for doing that. And we think they're all about 25% beta glucans. We want to give about 10 milligrams of beta glucans for every 2 pounds, 2.2 pounds, kilogram body weight daily. So give me the weight, and I'll compute it in between questions.
Yeah. The name of is Common Sense. So Common Sense, if you're still on here, we'll keep an eye out for you to list the weight, and we'll see if we can give a little more.
I guess you also asked about feeding real mushrooms.
70 to 80 pound senior boxer.
Right. So, and you also asked if you can feed real mushrooms, and of course you can give fresh mushrooms, I guess is a better word to use, at the same time, because we're the real mushrooms in terms of the extracts. But you want to make sure you cook them. They need to be cooked well in order to provide, in order to release their active compounds. And so,
yeah.
Do the math here. So it's a little less than 40 kgs. Let's just kind of round it up, because these aren't precise. This isn't like pharmaceutical dosages. So if we say it's 40 kgs, and let's say we want to try and give 10 mgs per kg, that's 400 milligrams of beta glucans per day. So if you have the powder and you're doing half a teaspoon, then half a teaspoon would have 250 milligrams in it. So maybe 3/4 of a teaspoon of the powder per day. You could divide that into 2 doses, morning and night, if the taste of it is a little bit uncomfortable to your boxer. And if it were a 500 milligram capsule, 500 milligrams is a quarter of a teaspoon, or half the amount that I just said. So you'd have to give more of those. Our pet labeled capsules are only 300 milligrams, so you just kind of have to do that math there. But sounds like probably 3/4 of a teaspoon of of a mushroom. That's approximately 25%, which would be the lion's mane or the 5 defenders, the turkey tail. The reishi's a little lower, but it's actually, they're all about the same, and I don't think we have to quibble over small percentage points.
And it looks like this person has powder and capsule.
Oh, okay.
I'll play with that. And I just in case you, because I know that was a lot of information Doc Silver gave, he started talking about this about the 19-minute mark. So when the recording comes out, which happens right after we finish the live, you can go to the 19-minute mark and listen to it if you need to get that dosing.
I know that people whose pets have cancer are very concerned about their well-being and very motivated to do everything they're possible, and sometimes get a little bit too granular. I'm not criticizing you because I understand why, about the precise dosing. And so I just wanted to be clear that mushrooms are so forgiving and they have so much in them, and they're not really a drug, and we don't really have precise amounts. This is just a model I've created to enable us to get started with an appropriate amount based on some studies and things. So I wouldn't lose sleep over it. I would just make sure you get half a teaspoon or a teaspoon in there daily. And I'm glad that you're giving the reishi, because I really think that for liver, it's really the best of all of the mushrooms.
So I hope that helps, and good luck to you.
Thanks, Jim.
Let's see the next. I submitted a question through email, but it's limited to the words. The collie hound mix, he isn't able to use most traditional things to help his arthritis, either due to ingredient sensitivities or they upset his stomach. I always wonder if that is the collie in him, maybe.
Yeah.
What are the best mushrooms to help with pain and inflammation? He has arthritis in his neck, jaw, and hips, feet, and back. Also, if you give multiple mushrooms, do you have a suggestion on how to rotate them to prevent upsetting the stomach?
Mm-hmm. Well, I think probably the best mushroom that I've been reading about for arthritis is cordyceps. And cordycepin, which is the unique to cordyceps, has some very good studies about its ability to improve analgesia. It also helps with older dogs, just in terms of energy and stamina and quality of life. You might want to consider CBD as a non-pharmaceutical possibility, although it may also have some effect on the MDR1 gene that we're seeing with collies in general. So I would look at that. I would look at cordyceps. I would start low because you do have a sensitive animal and try to increase that. There's really no need to rotate them. In this case, I think I would just stick with the cordyceps personally, especially with a dog that's sensitive. You don't want to upset the apple cart. Cordyceps should be very well tolerated. It's a relative of some very tasty edible mushrooms called morels and truffles. But always start low and give it time. Give time for the digestive system to adapt to that new stuff that's going in there.
Yeah. And I like the idea of just using one mushroom with a dog that's
it's
sensitive to begin with, and just kind of try it out and see how he responds to it. But that's great. I love hearing that about the cordyceps and
I'm really up for cordyceps, and I'm going to start doing a lot more on that because it's fascinating. I'm starting to get like a reishi cordyceps kind of a thing going.
Yeah, no, cordyceps is slowly, I mean, lion's mane's still my favorite mushroom, but cordyceps is slowly starting to gain steam. So and reishi too. I mean,
I take those three every day. I take reishi, cordyceps, and lion's mane.
Yeah, every day I take lion's mane, tremella, and chaga. Okay. But in my coffee. So I put powders in my coffee, and then I take the 5 defenders in the afternoon, and then I take some. Oh gosh, yeah. I can't have too many mushrooms, in my opinion.
Anyway, enough about us. What's the next question?
Yeah, I know exactly. Crazy question, but do any mushrooms help cats for behavioral issues?
Easy answer: yes. I would look at lion's mane, and fortunately for your cat and for you, lion's mane is very palatable to cats, especially if you start with a little bit and work your way up, putting it in some very tasty wet food. And the randomly urinating around the house, the young cat may very well be behavioral. I agree, especially if you check for stones or crystals or things like that. Cats can also get another problem, which is called inflammatory cystitis. And here we're talking about inflammation. And this is a situation where and oftentimes it's neurogenic, it's stress related, that the bladder just gets so inflamed that the minute it gets filled with too much urine, it's uncomfortable and the cat has to empty it. And that's a harder diagnosis to make for your veterinarian. Oftentimes it's through rule outs and working on behavioral issues, and they're not working, because the only way that I know you would do it would be to actually take a look inside the bladder or take a little piece of the bladder, and that's not really very practical. So yeah, I would look at Lion's Mane, and I know a lot of people don't like the idea of putting them on a psychiatric drug like Prozac, but Prozac could be very helpful for this as well. I would try the Lion's Mane first. Of course, you could use the two together. I've used Prozac successfully in my own cats in the house because the other techniques I used weren't working, and that urinating in the house is not a fun thing and can actually be quite damaging to furniture and the house and floors and carpets and walls and things. I feel your pain.
And unfortunately, I mean, I know you and this person wouldn't do this, but it's one of the biggest reasons that animals are turned back into shelters, and which, is for inappropriate urination. So it's definitely an important topic. Next one, I recently bought the 5 Defenders powder for my senior chorkie because Chihuahua Yorkie.
Oh, okay.
Because she's been having more difficulties breathing at night only.
I have to interject. So why would you call it a wow wow versus a chorkie? Okay, I'm done.
Okay. She gulps, licks, and lifts her head up and back like she's trying to stretch out her neck or throat. She also slowly scratches her ears. I've had her to the vet multiple times for these issues, and every time the vet says she's fine. It seems like inflammation to me. The question is, how long do I give it to her? Every day? And how long until it gets into, I don't know. Well, that's where it ends. But yeah, so 5 Defenders powder. It doesn't say how long you've been giving it, the 5 Defenders, but what do you think, Doc Rob?
I wonder if this isn't some sort of a epileptic type of deal. Stretching of the neck and with the fact that there's nothing that's been found on physical examination. Don't know. Into her system, I should say. Okay. So nonetheless, I think, for some reason, Lion's Mane is coming up quite a bit tonight as far as behavioral things. And certainly it has anti-inflammatory activity. And I would consider Lion's Mane, but we do know that cordyceps, for instance, is very active in the lungs and respiratory system. So, it might be that, this is a case where you might want to look at using some cordyceps, and Lion's Mane together.
For your chorkie. Yeah.
For you. Punchy here.
It's not a humorous topic.
You don't mean to make fun of your.
But yeah, no. What you mentioned, Doc Rob, about that it could be some sort of a seizure or something. I mean,
it's a small seizure. They have these behavioral types of epilepsy where you might see a dog like snapping at flies that aren't really there, or circling that's not a vestibular type of a deal. So I wouldn't rule that out. It's a senior dog, and it's a smaller dog, and oftentimes they have more likelihood to have those sorts of issues, at least in my experience. So
I'll just the reason that it stood out to me, and I'll just share a little bit of a personal story. My mother suffered from epilepsy, and she would have petit mal seizures, and her seizures were sometimes she'd have 20 to 30 a day, and they didn't look like a seizure. They were kind of odd movements and even verbal.
Okay.
And And she was told for 20 years that it was all in her head. They did all kinds of tests until one day she actually had one in her doctor's office.
Oh, wow.
He was like, "Oh my gosh, you've been having seizures." So I definitely wouldn't rule it out if there's this particular behavior, and the way it's sounding, the stretching and the licking and gulping.
Yeah, maybe. I mean, one way to kind of challenge that, which probably doesn't have much favor with many people, would be to put the dog on an anti-epileptic
Yeah,
medicine and see if the behavior goes away. And there's
yeah,
some that aren't as sedative or as or more benign than others that might
yeah,
be a possibility.
yeah. But I would be curious to see what Lion's Mane.
Yeah, absolutely. I would always, I don't think it's a big crisis type of thing. The dog's not suffering. You're probably suffering more than the dog is.
Yeah.
So I would definitely start the more benign, more natural treatment first. Give that a good month, I would say, or two before you might say, well, maybe I need to think about what Dr. Silver recommended or suggested or,
Mhm.
questions.
Absolutely. Yeah. Best of luck to you with that.
Yeah.
So let me I'm scrolling through uh, the comments coming out. Thank you. Jordan, I want to give a shout out to Jordan, our Oz behind the curtain. Jordan, our customer service manager, uh, you've gotten to meet once or twice in on the front of the out on the where me and Doc Rob are, but she feeds us the questions and keeps up with everything and answers stuff in the chat. So
Thank you, Jordan.
thank you, Jordan Swain. You're amazing.
Mhm.
So the next question from Nicole: I submitted a question online. I'm new to your group. Am I supposed to ask it here? I asked about a white lab with severe allergies. Nicole, if you're good. He's 117 pounds, and I would love to get him off Apoquel. He gets cysts between his toes from licking. And we do have a list of questions that have been submitted. It's probably there, Nicole. But it's always great if you're here live and can ask it.
Mhm. I guess, I hear with the Apoquel that some dogs do very well with it and some dogs don't. It maybe has an immediate, a first effect that's good and then kind of wears off. My experience with, and I don't know if this is the only form of allergy, is just the licking between his toes. And maybe the licking is causing the cysts, or possibly the cysts are a sort of a skin reaction to the allergies. So they could be, and then it annoys him and he's licking it. But I've often found that the interdigital licking of the toes, maybe licking of the anus, or anal gland issues, oftentimes ears getting kind of goopy, are associated with food allergies. And so I don't know if you have explored that or if you're just simply treating symptomatically, but it's probably worthwhile to try to get to the root of what is triggering these things. That being, and there's some saliva tests, which I think are better than the blood tests, and you may want to talk to a vet about that. But if you wanted to go ahead and try some mushrooms to see if they would be helpful for him, and you could use them concurrently with the Apoquel without a problem, I would suggest, there's two mushrooms that we know. Okay, so, and so maybe the food that he's getting, although it's only salmon, there may be other ingredients in it that he's sensitive to. Also, once a dog is not allergic to one thing, but allergic to many things, and you have him just on that one thing he's not allergic to, they then can develop allergies to that as well. Allergies aren't static.
Yeah.
So I personally like this saliva test that Dr. Gene Dodds has created, and you can purchase it online at nutriscan.org, and they're not cheap, but it's very worthwhile. They give you like 24 different food ingredients and maybe 5 or different other foods that cross react. So it gives you a wide range of ingredients.
Yeah.
They send you a little piece of rope that you put in the dog's mouth. They salivate, they soak it with saliva, you put it in a tube, send it back, and then they give you the analysis. And that has worked really well for me. But as far as mushrooms, chaga and reishi are known to be best for their antihistaminic effect, and they both have good levels of beta glucans, which help to regulate and reduce the reactive nature of the immune system, what we see in allergies, and They also have the I think I mentioned the antihistaminic effect, and they help to regulate the immune system. So they could be very good. We have both of them combined in our 5 defenders, and we've had anecdotal reports even from people with seasonal allergies that they did seem to find that helping. So I would say, that's probably the answer you're looking for from us tonight, but it may not be getting to the root of the problem. And or maybe you do know the root of the problem, which is food allergy, but maybe the food allergies are shifting.
Yeah. I wanted to add something to that wonderful answer, Doc Silver. Nicole, you mentioned that salmon food. Are you feeding dry food? Is it a kibble? Because if it is, you might want to add some dry food can be very inflammatory as well. And maybe adding some water or some bone broth to it just to soak the food to make it a little bit easier on the system. Oh yeah, so dry. Yeah, so I would, personally, I would wet that. If you're giving dry, wet it, make it a little easier getting into the system. Would you agree with that? Am I on the right track, Dr. Silver?
I think I dislike dry food
Yeah, I'm trying to be
a lot of problems associated.
I'm
But
trying to be diplomatic.
it feeds the masses, and many dogs are able to have a decent diet because of there's so much dry pet food out there. But for those that have special problems, and special needs, sometimes I don't think the dry food matches up. The pressures and heat of processing creates a pro-inflammatory compound. We call it glycotoxin. The multiple ingredients that are in there, any one of them could trigger more of an allergic reaction. Even the salmon itself, as I'm saying, there may have been some shifts in that. So there's a lot more choices these days as far as commercially prepared foods that aren't dry foods that might be solutions. But I think the first place to start would be the saliva test to at least find out what ingredients, when you read that label, you need to avoid. And many times in these pet food manufacturing plants, they'll run one run and then another run, and they don't really clean the machinery out well enough. So even if you have a salmon, it might be that whatever they ran before that, had something that the dog is sensitive to. So if you look for products that say they're limited antigen, for instance, oftentimes the companies that do it, they're supposed to, when they say limited antigen, completely clean out the machinery before running the next one, or have a whole set of dedicated machinery to each diet type of thing. So those are the things I would be looking at.
Yeah, I'd also, I'm wondering what maybe home cooking would help this dog. And
that's not for everybody. Home cooking would be helpful, but it's not for everybody.
I think of dry food, and then giving medication to lower inflammation or taking products to lower inflammation. It's like you're feeding inflammation while at the same time you're trying to remove it.
For many people, dry food is very convenient. We all have such busy lifestyles. It's hard to find time, even to feed ourselves well, much more.
Exactly.
So I think dry food serves a purpose as much as I think it can be problematic for many dogs.
Yeah. And that's why I was suggesting at least adding liquid
Yeah.
lowers that, it makes it a little bit easier on the system. And Nicole's asking what we recommend for food. I mean, there's a lot of good places online. There's a website, The Truth About Pet Food, that has that reviews all different kinds of pet foods. Pet Food Advisor is another one.
Farm Dog, I think that's one. I mean, depending on your budget, there's companies that will actually make it to your specifications and ship it to you, on a regular schedule.
Yeah.
So I think that I think when you ask what you recommend for food, you're probably saying, well, if I can't feed kibble, what can I feed? And and so they have frozen raw. They've got cooked food if raw is something that you're worried about. And there are all these new boutique companies that I think are doing a really excellent job. And the reason why these boutique companies are starting up and actually surviving is because there are so many pet parents that recognize the value of that approach to feeding. Now, I think home preparation is probably the best, and it's also the funnest if you've got the time. I mean, and that's how I do with my guy. Every day, you're preparing it. He's kind of sitting there going, "Oh, right, I'm getting food." He's a lab too, a white lab, like
Yeah.
yours, Nicole, with a lot of problems, but not allergies. He's got musculoskeletal issues and PTSD. So, take your pick.
Yeah. Yeah. But no, it's true. I mean, food is so important. And, we look at it, on the human side of things, we're being told to avoid processed food and to eat as much fresh food as possible. And, we're seeing that in the pet space. People are kind of recognizing the common sense of that with their pets as well. Like, why would we want to eat fresh, organic food that's not in a can? Like they say, shop the outside when you go to the grocery store. Don't shop in the middle of the store. Around the outside, you've got the produce, you've got the meats, you've got the dairy, the fresh food. But then we go and we grab the kibble. And again, I agree with you, Rob. It's convenient financially. It's what many people can do. So I'm not in any way trying to shame people that are giving dry food. I think it's important just to kind of put it out there. Like, just, think about it. Like, would you want to eat that? Imagine like putting dry food in your mouth, chewing on it, swallowing it, like how it would feel in your system.
In the exam room, oftentimes I'd take a dog biscuit and I'd start eating it. He'll go, "Ooh," and just think about that. And I'd say, think about that. This is what you're feeding your dog, and you're disgusted by it.
Yeah.
I mean, dogs lick their butt. They eat a lot of things that, we would never even consider eating, including poop. But, they still have the same kinds of needs we have for clean food.
Yeah, they're very adaptable. Dogs are adaptable. They can eat anything, but over time they start to suffer from deficiency, which then turns into symptoms and syndromes and disease. And that usually can happen around the 8 to 10 year phase is what I notice, and so that didn't suddenly happen. It's been a nutritional deficiency adding to, maybe some genetic stuff or whatever. But anyway, I hope that helps, Nicole. And again, we're not trying to, whatever you're feeding, y'all are doing a great job with your pets. And it's great. It's great if you want to strive to do a little better, even adding a tiny bit of fresh food, a little bit at a time, and go from there. So let's move on to the next question, huh? Shelly says, I have a 7-year-old cat, otherwise healthy, with chronic low-level ear infection causing scratching. It is not food related. Wondering if a specific mushroom could help. So a low-level infection.
That's a tough question.
Yeah.
I think that, certainly, I don't know about a specific mushroom since I don't really have a specific diagnosis. Since tonight's topic is inflammation, I think, looking at using a mushroom as kind of a general tonic that would help to reduce inflammation and help to correct some things that we not really sure what's wrong is what I would suggest. And, otherwise healthy, I would choose cordyceps. I think cordyceps is perfect for cats. There's a great deal of evidence that cordyceps helps to protect the kidneys. So for a 7-year-old cat, you're just starting to get into that aging process where the kidneys may start, having some issues. So I would say the cordyceps will reduce inflammation. Cordyceps will help to protect the kidneys and have, other good general benefits. That it's really going to help. I mean, don't come back to the doc. You said use cordyceps and didn't work. So I don't really know quite what you have there. Sometimes and you say infection. So is it really infection or is it just itching at it? Is it goopy ears? I mean, maybe there's mites in there or something like that. So I'd try to get to the bottom of that first, but I think cordyceps would do no harm and would probably do some good in general as well.
Yeah, I would agree. Sue says, hi, Sue. Oh, Sue Shufflick. Hi there.
I've seen you before.
My dog currently takes human doses of turkey tail, lion's mane, and 5 defenders. She has no specific issues. I use them for immune support. Is it okay to add cordyceps too? She has some arthritis, and if it helps with that, I'd like to add it. She has no issues with all of these powders in her food.
Perfect. Yeah, Absolutely. The more the merrier.
Yeah.
Mhm.
It's yeah, Scruffy gets out. I think Scruffy gets all the mushrooms. My dog. And she has no problems at all. She loves it. So the next one, next question. When I get the Lions Mane and Cordyceps powders, can I give them at the same time as I give the 5 Defenders powder?
Looks like we're having some connection issues. Are you noticing that, Joni?
Well, you've been freezing on and off, but
So have
you're
you. It's you
oh,
freezing.
okay.
Yeah.
You're
I wonder if there's a way for us to turn off the video and just have the audio so that it works better. Or maybe we got 15 minutes left. Let's cross our fingers.
yeah.
We can get
I
through
think
this.
I think as long as the audio continues to work,
Okay.
we'll just freeze on and off.
All
Yeah.
right. Sorry for the connection issues, but I guess everybody should be used to that stuff now. Okay. Answer is yes. Yes.
So
There's,
you
there's,
can
yeah.
give them at the same time. Yeah.
Absolutely.
Yeah, you just want to be careful, of course, that you're not going to cause gastric distress by giving too many new things at once.
Mm-hmm.
You might want to start them like one at a time, just to make sure that, anytime you add, whether it's a new food, a new herb, a new supplement, you just want to make sure that that your pet, tolerates it well and it doesn't cause diarrhea.
And lion's mane is known actually for having a gentling effect on the digestive system, especially the upper GI. So maybe start with the lion's mane.
Yeah, that's a good idea. Absolutely. So hi, Deborah. Deborah has a question. Hello, I'm new to the group and late to this discussion. Typically, how long does it take to start seeing improvement after starting 5 Defenders?
Well, I guess part of it would depend on what it is we're using it for, but I generally caution people that 2 weeks would be a minimum period of time and more likely a month. But we do see more immediate responses in some cases, like with some calming with the lion's mane. But I think really mushrooms are more of a daily sort of a deal, and you have to give them some time to get started. So I would be patient.
Yeah, yeah. My experience is they seem to work best over time and give kind of a vitality and a vigilance to the system.
Yeah.
But you're right. There are some more acute, the lion's mane, for instance, and of
Sure.
course your chews, your relaxed chews work very quickly.
There's a couple of secret ingredients in there.
Yeah, that's often the other ingredient. Yeah. Okay. Is it safe to give mushrooms to dogs daily? I saw a post regarding lion's mane and to be careful.
Well, you may have seen the same blog that we saw that was kind of scary. And we've gotten some questions on that already. So I did a deep dive into it and looked through the world literature, did a literature review, trying to find evidence that they're in this from this blog, which may be what you read. It was a really long blog with lots of problems and only like 4 little references at the bottom. And then I spoke with a colleague of mine who has published a very excellent paper on lion's mane. He's a pharmacologist, and he just said, "Yeah, I wouldn't worry about that. It's pretty safe to use." So I wouldn't worry about it, unless you're, maybe giving, a couple of ounces at a time. That might be quite a bit, but at the standard dosages that we recommend, there should be no problems giving them daily. And if you want to take a break and just give them maybe 5 days a week and 2 days off, or 6 days a week and a day off, that's okay too, because once you've been using them for a while, the immune system and the rest of the body kind of gets trained and kind of builds up. And so you can take a break for a day or two if need be, or you're on vacation, or you forget, or this or that, or you run out and the shipment hasn't come in. Don't stress.
I hope that helps. Next question. Are mushrooms contraindicated with corticosteroids like prednisone?
Good question.
Yes. For example, I think lion's mane may affect metabolization? Question mark.
This was actually from that same blog. And so again, no, do not worry. There is no interaction. And although I don't want to quote exactly my colleague, the PhD pharmacologist, but he basically said it was BS, only he spelled it out. So don't worry. It's okay.
It's okay. Next question. My dog has idiopathic epilepsy and is on a combo of phenobarbital and levetiracetam.
Levacequin.
Oh,
Mhm.
thank you. That's a new one for me. Are any of the pet options going to cause complications or reduce the effectiveness of his medication?
Not as far as we no, I guess the answer would be no, don't worry about that.
Yeah. Yep. The next question. My dog has a lump on one paw that appeared after an ant bite 4 months ago. The lump is getting bigger. The vet wants to remove it, but also says that it could affect mobility. Any mushrooms that might help?
I wonder, if this lump was just coincidental to the ant bite, and in fact might be more of some sort of a benign or not benign type of a mass. I don't know. If I were doing it, I would stick a needle in it and draw cells out and put them on a slide and try to see if I understood what was going on in that lump. Is it neoplastic or what? And lumps on feet, there's not a lot of extra skin on that foot, and depending on the size of the lump, it's hard to cover that over. Probably your vet's covering his what, because most of the time you can remove those, and it may affect mobility while we're in the healing process, and he may need to bandage it or splint it so that the movement of the foot doesn't impair the healing process. And certainly mushrooms actually do help with healing, and with wound healing, because the beta glucans help the immune system to do that. So, if it's a tumor, there's lots of lumps and they're not all the same thing. So if it's a tumor, then, probably looking at something like turkey tail or the five defenders would be
Yeah.
where I would go. If it's just inflammation, well, I guess I'd probably just go with the five defenders,
Yeah.
which is kind of a shotgun. So it kind of covers those things. The turkey tail's in the five defenders. So probably don't need to do both unless it really is some kind of a nasty cancer and you want to increase the amount of turkey tail for better effect, or use a higher dosage of the 5D.
Yeah. Yeah. But definitely, just maybe five defenders. Give it a try and see how it goes. Whether you decide to remove.
I would say if you're going to, I would say, I would suggest strongly that you remove it before the lump gets too big. It's as big as it's going to get right now, but it's going to, it's at its largest right now, but if it gets bigger, it can even be more difficult to remove. There could be much more post-surgical, complications the larger it is. So I would make that decision soon, and in order to get that lump size
Yeah.
down.
Yeah.
Out of there, rather. Mhm.
Yeah. Thanks, Doc Silver. The next question. My dogs are young and I follow a holistic protocol. I'm using five defenders, the human version, to prevent issues in the future, as well as to control inflammation in my own body. Is this the best product for that?
Yes, I would say it is, because it has those five very potent mushrooms that are strong anti-inflammatories and kind of cover a number of bases. So yeah, I think that's a good protocol for you. Mhm.
Yeah. Yeah. No, I agree. And, just a little anecdotal, we get these reviews, people that, they buy our products and then they review them on online. And I get a little ping on my phone every time somebody leaves a review. And I'm surprised by how many people in their reviews talk about five defenders and how it's helping them with their pain, with their inflammation, et cetera. I'm most surprised by the pain, like I'm moving better, et cetera, et cetera. So I really think that five defenders is an excellent anti-inflammatory based on based on my phone pinging constantly about it.
You get any sleep?
I, know. I put it on silent at night,
Well,
but
that's
we get a lot. I'm amazed by how many, we get a lot of wonderful feedback, and I'm surprised that most of it's actually really good. I would think I don't leave many reviews, maybe I should more because it's really great to hear from, from people, and we get tons of feedback from people about their pets, you know, and again, this is all anecdotal, but it's like my dog has lived, you know, 2 years past the date that the vet told me, to expect my dog to live, or this, this shrunk, or my dog has so much more energy. My dog's behavior has changed since, being on this or that. So yeah, it's always rewarding to read these. It's why we do what we do, right? The next question, so the chorkie. So the person that we were talking to with the chorkie, is sharing that she's a raw feeder, so she's doing a 80-10-10 raw meat food mix with her mushroom powder and with bone broth, so she's asking if she can give all the powders in the morning. That's fine,
Yes.
right? Yeah,
Absolutely.
yeah, absolutely. It's easy, whatever, right? Isn't it? Whatever's easiest. Like
Better
we're all busy, just as long as you get it in, whether it's you're getting it yourself or your pet.
It's the regular administration that really is the key to the value of mushrooms, much more so than one, short-term effect.
Yep, absolutely. The next one, do cats do well with the palatability of the mushrooms? We have picky little guys, and wondered if there were any they really didn't like. I understand that. Yeah, just hate by any that they don't like and get stuck with it. Yeah. Oop, we might have lost Rob. Oh, there we are. You back?
No, I thought we lost you. Anyway, as I've said, and I keep saying that for cats, I think cordyceps is really the ideal quintessential mushroom, not just because it has value for kidney disease and other things, and feline asthma, to answer a question there it might not get to, because it's also good for human asthma and feline asthma, but it's also very tasty to cats, and as is lion's mane. So those would be the two, the cordy mane. And my suggestion is with any cat that you start with just a teensy amount, because cats might like something, but you have to kind of convince them. And if you start with a large amount in their food, it's going to dissuade them immediately, and then they start getting suspicious. So I think it's much better to start with a teensy amount in some really tasty bride food, and hopefully wet food, because I don't think you're going to get them to eat. You may get them to eat it on dry food, but I'm skeptical. And then gradually increase it to what would be the optimal dosage for their weight or the condition that you're treating them for. So I think that would be my suggestion. One for both of those.
Yeah, absolutely. And reishi, as we talked about earlier, that's the most bitter of the mushrooms. So that would be one, unless you have a cat that will eat absolutely anything. You might not want to buy straight reishi for your cat, because it's just instinctively they avoid bitter.
Okay.
Next question is, cordyceps the mushroom that can be helpful for asthma with people?
Yes, and with cats, because it supports both the kidneys and the lungs. And we recognize, in Chinese medicine at least, that there's a relationship between the kidneys and the lungs in asthma. And so, very good for that, good for chronic bronchial inflammation and cough.
Yep. Next question.
Back to the cat.
The lightning round, because we got 3 minutes left. Cat with chronic. Okay. So the cat with chronic ear infection has no. I just read these because sometimes people are listening, Rob, and not reading.
I'm like.
I know. And I'm like the teacher, like, no, don't jump ahead. So the person that was talking about the cat with the chronic ear infections does not have mites. Seems to be a low-level bacteria. Tried single protein food and no effect.
So I think, using a mushroom would be good for its ability to improve the immune system response to a low level of bacteria in there. And because it's a cat, I would probably say turkey tail would probably have or reishi would have the highest antimicrobial activity, but I think they could be problematic for taste. So that's where I would say, let's go for the cordyceps. Let's go for the lion's mane. Let's go for one or the other. Or let's go for the both. And then the advice I gave, as far as introducing it to a cat, holds true for all the cats. In this show.
Yeah, I hope that helps.
Mm-hmm.
Next question: what would be the best mushroom to support a dog with kidney disease?
Cordyceps.
Yep.
Cordyceps has very good research about its ability to actually lower creatinine levels in I think human patients actually with chronic kidney disease. So I would go cordyceps for sure.
No, definitely, me too. And we have One more, we have time for one more quick question. Jordan, you got one? Oh, there you go. How can I get the turkey tail to dissolve for my pup to drink? Sprinkle it on food doesn't work well.
Well, the mushrooms have a lot of insoluble fiber, so I don't know that you're going to get the to dissolve. So you may want to see if you can put it in some hot water. Maybe that would help it to disperse better. We have like a little frother that might, distribute it through the water better. But I don't know if your dog will voluntarily drink it in the water if it's not taking it on the food. So you might want to look at capsules. That's one reason why we made the capsules, because not every animal, dog or cat, will accept the taste of mushrooms in their food, especially some of these more bitter ones like turkey tail or reishi. So maybe capsules are the answer, and you're not going to be able to get it to drink it or sprinkle it on the food.
Yeah. Like as Doc Rob was saying, it's because of the insoluble fiber. When I drink, I put my powder in my coffee in the morning, and I have to, as I'm drinking it, I have to keep swirling it, or the powder will sink to the bottom. Not all of it, but there will be stuff left on the bottom. So I think it would be hard to put it in your dog's water, like dissolve it in there. I don't think that's really doable.
I'm actually working on figuring out a way to make our mushrooms into liquids.
Well, interesting.
Yeah.
Stay tuned. All righty. Well, that is our hour. And well, this was fun. And so thankful for the people that show up, to those that sent their questions in advance, and also for those that are here live with us. Every month we look forward to it, and it's always a great time. And as soon as this ends, the recording will be available on all of our platforms. If you missed something and or want to hear it again. So we'll be back next month, the third Thursday in June. The third Thursday of the month is usually when we do these. Yeah.
Would you say that if there are any questions that we didn't get to, that they should pose them on the Facebook page and we'll look at them there?
Sure. Yeah, absolutely.
I know we didn't get to them all exactly, but
yeah,
we got to.
So for those that don't know, we have a Facebook page called Real Mushrooms for Pets. You can search for it on Facebook. It's a private group, but you're all invited. And we do questions and answers there, not live. We do the live once a month, but we're both in there answering questions as we can. And it's an active group. There's other people that are giving great advice in there about how they're working with their own pets and giving encouragement, etc. So by all means, join us there.
Cool.
And thank you, Dr. Silver.
Thank you, Joni.
Always a pleasure spending time with you.
Mm-hmm.
And of course, Jordan.
Yeah.
You, our superstar Jordan in the back there, who we'll try to, every month we try to drag her out. One of these months she'll come back. All right. Take care, everybody.